everyone, and welcome to the first in our exciting new webinar series on the anatomy of pain. I know it sounds a strange thing to say that a webinar series on pain is going to be exciting, but I realise that it might sound quite perverse, but perhaps I should rephrase it and say that in these specialist webinars, the aim is to explain pain and our relationship to it in an easy, accessible and practical way. It's a huge and complex subject, and these sessions aim to provide a basic knowledge and develop a deeper understanding about pain management. And it's because of this that we hope is going to become exciting for you as yoga practitioners and also as yoga sports coaches. Our Anatomy of Pain series has been developed especially for yoga sports science by Annelize Ferreira. Annelize is a physiotherapist and the consultant physiotherapist for yoga sports science, as well as one of the lead tutors on the yoga sports coaching course and an advanced yoga sports coach. I'm delighted to introduce Annelize to you. Annelize, hello and welcome.
Hello, Hayley. Hello, everybody else. Really happy
Hello.
to have you all. Yeah.
It's great. We've had some
Very
great
excited.
response. We've got lots of people joining us still, coming in from all over the world. So welcome
Brilliant.
to you all as you come into the session. Annelize, before we get started, actually, we should perhaps say about questions throughout the session today, Annelize. Do you think? I mean, if you have a question at any point and want to ask Annelize, or also share perhaps as well, more importantly, your experience or relationship with pain. I don't know if that's appropriate to say it like that, Annelize, but please raise your hand and also use the questions area as well. If you can't find the icon for raising your hand, it should just be a little yellow hand that you click on that once and we can see the hand come up, and we'll open up the mic to you and take your question. Before we get started though, Annelize, is there anything you'd like to say about the compilation of the work presented in this webinar?
Yes. So, as a physio, I work with athletes and clients who present with pain or have painful conditions, and I have over the years had to really do a lot of my own research into the subject of pain, and I've compiled this webinar from my own practical experience, but also the research of others, specifically Lorimer Moseley, and that's the clip that hopefully you've all watched, and also the work of the specialist pain physio called Richmond Stace. And I will refer to these practitioners and scientists throughout this webinar. So I hope you enjoy the information that we present to you throughout this webinar.
Thank you very much, Annelize. So would you like us to go to the first slide?
So if we just stay on this for a second, just to maybe give you the objective of this webinar. And I think it's important to know, as yoga sports science coaches or yoga sports coaches, that you will encounter the injured athlete or athlete who experience pain or discomfort in their sport, or even during your YSS intervention for our current trainee yoga sports coaches. And it's very important for us to know how to deal with an athlete in pain and why certain mindsets about pain exist among athletes. And we all know that athletes can have a very specific mindset about pain. For this, we need to know where and how pain is produced and what fuels the perception of pain. And the right physical and mental approach to pain can really change movement efficiency, improve performance and longevity within the athlete's sport. So I hope that from tonight's webinar, you can take a few practical tips already from this part one to take forward even tomorrow in your session with your clients or with your athlete. So Hayley, if we can move to the second slide, that'll be great. Thank you.
Okay, can you see that okay?
Yes, that's fine.
Great.
Thank you. So the specific aims of this webinar, so we're going to go over a very basic overview of pain anatomy. Like Hayley said, this is an absolutely huge subject, and I hope to explain this in terms that will be practical and functional for you to understand and also to get your head around. And as I said, a lot of the information comes from Lorimer Moseley, who's a very well-renowned neuroscientist and also a physiotherapy, and has done extensive research in this field. And I really do hope you all managed to get a look at the Wyatt Hertz clip. It's a lovely humoristic way of viewing the anatomy and understanding the anatomy of pain. So if you haven't, please feel free to have a look at that later. So also with then going on to point two, with this in mind, what does that mean for us? How can we use this information as yoga sports coaches? How can this inform our practice? And then hopefully, if we have time tonight, because as I said, we have quite a bit to cover, and also we would like a nice, good interaction as well, questions as well.
Yeah.
We will then, maybe if we have time, we'll go into the specific tools that we have as yoga sports coaches to actually help athletes in pain.
Great.
Right.
Okay.
So,
would you like to go
let's get started.
Let's get started.
Please.
Great. So we'll go to the next slide then, Annelize.
Yes, please.
Okay.
So what is pain? And I think I really want you to have a look at this, read it with me, because this is quite important to understand. Pain is an unpleasant, subjective experience, and a subjective refers to the physical and emotional areas of our being. And it's an output from the brain to protect us. It is influenced by a range of circumstantial factors. I'm sure you have all experienced pain. And you know what? That's good, because actually experiencing pain is normal. Pain is not very nice, but it's a normal and a very essential part of life. It protects you and alerts you to danger, often way before injury even happens or before you injure yourself badly. It makes you think differently, and we all know this. When you're in pain, you can't think straight. The only thing you're focusing on is on the pain. You almost wipe everything else out around you. We move differently. And actually the movement part and the protection part is vital for the initial healing process of the tissues that was maybe damaged. And I think it's important to know that this response and the danger response calls on all the body systems to protect. So the brain calls on all your body's response. So that's your immune system, your hormonal system, your movement patterns changes, and our parasympathetic and sympathetic nervous system. So your autonomic nervous system. So it's that nervous system that's not 100% under your own conscious control. So your sympathetic system is your fight and flight, and your parasympathetic system is your rest and digest system. And all these systems kicks in to try and protect and regain balance back in the body when there's danger signals. So the main thing here, I think, is what maybe just a point that I would really like to linger on, is the subjective experience. So subjective means, in this instance, pain is going to be different between different people. So my experience of pain might be completely different from Hayley's experience of pain. And at this stage, we would just like to do a little activity just to maybe see if we can see any differences within the cohort that's here with us tonight. So Hayley, we're gonna launch our poll, please.
Sure.
And we're going to do a little activity here just to show the differences in pain, or maybe not, we'll see.
Okay, so I'm going to launch the poll now. Let me know when you can see it on your screen.
Yeah.
Okay.
Right, so the activity is going to be, I would like you to take your, we're going to do a bit of a forearm stretch. So I would like you to take your dominant arm and just stretch your arm out in front of you so that your palm is facing upwards. So the elbow is fully extended or straight. And I want you to take your non-dominant hand and then very slowly and gently use your hand and gently pull your fingers down so that it's pointing down to the floor. And I want you to try and take it right to the end range. I want you to stay there just for a couple of seconds, and then slowly come back out of it once you've been to your full range. Once you've done that, I want you to score your pain on this Likert scale. So don't think about it too much. I want you just to choose one of those categories and submit, and then we'll have a look and see what.
Yeah, so we're getting the stats are coming in now, which is good. Excellent. Great.
So we can look at the percentages once they've all come in.
We'll just give people a little It's an interesting one. It's actually, you wonder whether you should give too much time to reflect on this. Maybe we should just not give too much time and go, right, okay, we're going to see. Don't think about it too much. Don't analyze it. What is it? Just what is it? What is the instant kind of instinctual feeling about, grading your pain? Okay, I'm going to close the poll. We are where we are. I'm closing that poll now. And then I'm going to share the results so we can see. Now look at this. Can you see the screen? Interesting, yes.
So this is very, very good, and I'm very glad that we got this response.
Yes.
So I think pretty much from this, and actually considering what professions we are and what we do, we are, most of us are, I'm sure, practices yoga. So you would almost expect a certain level of mobility and suppleness and flexibility. That for us is normal because it's something that we work with every day. And then, so pretty much half and half, no pain and mild. Now this is interesting. So there is a difference, and it shows you that some people don't think that's a painful activity, and other people actually do think there is a little bit of feedback. Now consider, this is, and I would again say for our cohort of people tonight, I think this is a very, very normal response, as they'd be all, I suppose, fairly flexible, mobile. But consider maybe this poll in an office worker. So maybe a weekend warrior is an office worker in the week, types away 8 hours in front of the computer, and then on a weekend wanting to do all sorts of weird and wonderful activities, sporting activities, asking that person to do this stretch, and they may actually say it's moderate to severe because of their profession, and possibly also because they don't do mobility. So their brain may actually give them the feedback that their response is moderate to severe. So this just shows you that even within our cohort, there's differences. And that is what I mean by subjective experiences. Pain is different for everybody. A stretch in some people may be no pain, it's just a stretch, where for other people it might be moderate to severe discomfort. So that's great, Hayley. So if you
great. I'm very glad that we didn't get anyone in the severe category or pain as bad as it could be.
It would be worrying.
It would be very worrying.
I would almost say, give me a call.
Yeah, exactly. Or we could say do a yoga sports science webinar with a health caution, future health cautions to joining our sessions. Okay, that's brilliant. That's really very interesting though, isn't it, Annelize?
Yes.
Great. Okay.
So this again, so the same injury in two different athletes will be experienced in completely different ways. And this also very much depends on the context, past experiences, levels of anxiety, who's attending to the problem. Is it a very experienced doctor? Is it just a first aider? Is it a physiotherapist? Is it the coach? And according to those, issues, a person may actually experience the pain in a slightly different way. So let me maybe explain this in practical terms. So around every injury, there's a set of circumstances that leads to the injurious event, a point in time that we call the injury moment. And this, say it's a footballer, this may include the stage of the game, the fitness of the player, the environment, previous experiences of pain, and prior successful and failed attempts to deal with the injury. Nothing happens in isolation. There's always a set of circumstances, even if it's something that's just happened off the cuff. There's always something that leads to that moment. So there's a set of circumstances or events that leads to and influence the injury moment and the future experiences of pain, and that's very important. So I'm going to draw on an example that Richmond State's specialist pain physio uses, I think, in a very nice way, and might be actually quite relevant for us as coaches as well. So if you think about the football players, very complex, moving, thinking, always seeking, monitoring the game, following the rhythm of the game. And depending on what he's thinking and doing, planning and anticipating within the game, the injury moment will unfold in that context. So say, for example, there could be a different response to a potential injury situation if the player feels less pressured, he had a better night's sleep, wasn't concerned about his place in the team. perhaps he would have managed to avoid the ankle inversion injury had his brain been better monitoring the game. There could also be outside influences, i.e. different players causing the injury. So this all remains in context and blends to formulate the player's emotional state at that moment in time that the injury unfolds. And this emotional state can also inform how the player deals and experience pain, and also how they deal with that situation in the future. So always remember, and this is maybe where as coaches, it's quite important if you do deal with the athlete in pain who has had an injury, on your questioning, find out what was the circumstances, because that is maybe something that you will have to help this player with, and it may make you understand why the player has certain pain beliefs or certain behaviors that's actually fueling their experience of pain.
May I just interrupt at that point, Annelize? I think it's a very powerful question, and actually one that I think should be included within client profiling or athlete profiling. I mean, what you're doing in this webinar, is highlighting something which, is not. I feel certainly in my career working with athletes is certainly not discussed enough. But it's such a smart thing to do, to sensitively ask an individual about their experience of pain, because you will understand more about the nature of the individual that you're working with.
Exactly, and if we go back to that definition, it's the brain that's giving you the output of pain. It's not the tissue that's giving you pain. The tissue is just giving the brain the input, and the brain is then giving the output of pain. So if there was a certain amount of cognitive thinking, and if this has happened before, or if the previous injury was very acute and had a very poor outcome, that athlete is going to have preconceived ideas of how this may unfold, and therefore their pain behavior may be even exaggerated. And that pain, and we're going to come to that later, that pain behavior of guarding, fear avoidance, almost being hypersensitive, can actually really mute the healing process and really mute the brain's ability to see the input or see the injury for what it is, rather than a catastrophizing event. So we'll come to that later on as well. So
Sorry, I'd like to bring in Dr. Abby Hoffman at this point, if you don't mind, because I'm very interested to expand this from a performance perspective. If within a performance, whether as an athlete or a dancer, part of what you do to perform, there is a level of pain or discomfort. Obviously, as again, this is a huge subject, so we're just kind of touching on this, but I'm curious to know from a dancer's perspective about the future experience of pain, knowing that a certain performance is you're working through that, you're performing through pain. Unfortunately, Ambra Valero can't join us tonight. Ambra, for those of you that know, has just recently retired as a principal dancer for the Royal Birmingham National Ballet, but we have Dr. Abby Hoffman in the session tonight. And Abby, I'd like to go to you, please, just to get your thoughts on what Annelize has said so far. So just going to open up the mic to you, Abby. Hi.
Hi.
Hello, Abby. Thanks for joining us.
Hi.
Can I just get your thoughts on what Annelize has said, and certainly in relation to, from the dancer's perspective?
Yeah, sure. Thanks. Hi, Annelize.
Hello,
Nice to hear the webinar so far. It's fascinating. Well, probably the old adage, the show must go on, applies here, and that, unlike athletes, dancers don't have an off season, and they do continue training, performing throughout the year. And also, I'm sure you know the oft quoted statistic that 80% of dancers are injured in any one year, which comes from the Dance UK stats. So it is a big problem, and it is something that I think what you were just saying about potentially screening and asking about pain would be an absolutely key and vital part of getting dancers to understand, and for us as coaches or as people working with dancers, to bring this into the discussion, because I think that also what the problem is for a lot of dancers is not being able to differentiate between performance pain, which, as we know, is something that athletes and dancers can work with, and injury pain, which is something different. So I think, yeah, there's a lot of work to do. The culture embraces this notion that the show must go on and that dancers need to be able to dance through pain. But I think really the key is more education with dancers about the kinds of pain and the level of pain that is particular and, as Annelize says, subjective to them. And I'm not sure that a huge amount of research has been done into this, so it is a very interesting and ripe area for the dance profession to look at.
Great, interesting.
Yeah. And I think that's a common problem in most sports, really educating the athlete when is something productive pain, or when is something productive discomfort, and when is something pathological. And I think a bit, and it's probably where yoga sports coaches comes in, is with these athletes that unfortunately, like you say, the show must go on. It's their livelihood. Recovery and restorative practices are absolutely crucial to desensitize that nervous system and that brain response, where if you don't step back and don't allow the body to recover, whether it's just a breathing practice or just a mobility practice, that athlete or dancer may spiral into a chronic pain situation that is disastrous for most athletes.
I agree, and I think one of the ways that yoga particularly could work and function extremely well in this instance is in helping dancers and athletes, of course, to assess for themselves where their edges are and how they can instigate coping strategies or coping styles with pain, and trying to differentiate between the different levels and ways that pain or sensation present in the body, because I don't think a lot of dancers have that.
Yeah, and I think there is definitely specific objective, there's questionnaires you can use, but also objectively, really, if pain starts influencing motor control, balance, how you move, that is when you know pain, or the brain is going in overdrive to protect.
Interesting.
So, like I said, there is a certain amount of performance pain that the body can put up with, and we'll see that later. But it's recognizing whether that is becoming the norm or whether it's just a one-off.
Yeah, I agree.
Great. Interesting. I know we've got a lot to get through, so Abby, thank you for that perspective. And as we go through the session, if there's anything else you want to touch base on, please raise your hand. Abby. Okay, thanks, Abby. Closing the mic there now. So cracking on. We've got a lot to do. It very interesting, isn't it? About
Go
ahead.
Thank you very much, Abby, for your input there. So when the injury occurs, tissues do get damaged and danger signals. So I say danger signals, I don't say pain signals, because it's not pain that goes up your spinal cord. It's actually just a danger sensor that gets set off by possibly some damage. And this danger signal then gets sent up the spinal cord to your brain, and the brain then asks many questions. It basically has to make sense of, what does this input mean? Is this life-threatening input? Where is this input coming from? Where is it happening? Is it a vital part of the body? Is it, for instance, the heart, or is it just your ankle? Is it a finger? And most importantly, has this happened before? So then the brain decides on the best biological action. So on deciding that there's a threat and that something is dangerous, and something dangerous has happened, the brain will then project the experience of pain to that area that requires protection. So that is where the protection is coming from. So again, pain is normal. It's a protection to basically protect us from life-threatening or dangerous situations. So the basis of pain is normal, and it's normal to feel pain. So if we move on to the next slide, Hayley.
Sure. And I would just like to encourage any of you who would like to, share your, I know it sounds a strange thing to say, but your pain stories. If there's anything, that you would like to share with us, please, we would be very interested to hear. Okay, so can you see the slide, Annelize?
Right, yes, I can.
Okay.
So this is just, we're going to go into a little bit of anatomy here. So we have a picture here of the danger signals that this is quite a basic representation, but it's quite easy to understand, really. So this is a danger signal pathway from injured tissue in the finger. And again, I don't use the word pain pathway because it's not pain that gets transmitted up to the brain. It's just an input. So whether that's mechanical, thermal, chemical, and then the brain decides on what output it wants to give. So we're going to use the example of a basketball player here. So for instance, the basketball player has caught a ball and the ball has hit the top of the finger and taken that finger into forced hyperextension. So basically bent the joint, the distal joint, into hyperextension. The experience of the initial acute pain in this scenario is typical inflammatory, so whereby chemicals are released by the damaged tissue. So if there's anything strained or tissue is ripped or torn, you get an instant chemical release. And this then really sensitizes the senses, or what we call the free nerve endings. So the free nerve ending is literally what it says on the tin. It's the end of the nerve, and these free nerve endings sits in the skin and in the joints. They then open and positively charged particles rush into the neuron. A neuron is a nerve cell, and this sets up like an action potential. So it's almost like an electrical charge. And then these nerves are now very excited and they send these danger signals, so not pain, these danger signals up into the spinal cord, and then special neurons or nerve cells, or what we call danger receptors, then relays this message to the middle of the brain, and specifically the thalamus, and it's almost like the switchboard of the brain, and it organizes all this incoming messages or danger signals. The brain now call upon different areas of the brain to evaluate the danger signals, the context, has this happened before, what was the consequences before, what was the mental state, where's the danger signals coming from, and what stage of the game is this happening, and even sometimes what stage of the gait cycle or walk cycle is happening. The output, so you can see on this picture actually that circle in the middle of the brain is the thalamus. The thalamus decides where it wants to send these signals, and on this representation actually you'll see the motor cortex, the orange bit, and the somatosensory cortex. So normally these are the main cortexes that will be called upon, and these questions will be organized by these areas, and they will then send a signal back to the thalamus that goes down the spinal cord, and that will then go down to the finger, and you will probably grab your finger or hold it close to your chest, and the output in this situation probably will be pain. But again, depending on the stage of the match, whether they're winning, losing, that athlete may or may not feel pain. So if you think about, so in most injuries, healing will occur, and the healing process will unfold. And for this type of injury, for a finger injury, it will take about 6 to 8 weeks to heal. And that's a normal case scenario. So initially it will be quite sore for a few days, it will be swollen, red, maybe a little bit bruised, a bit of bleeding around the area. Patient may possibly get some physio, or they may just decide to rest it and slowly start moving it as the function starts returning. However, in other athletes, or in my case, my patients, the pain may persist despite the healing occurring. In a large majority of people, this is possibly due to an ongoing protection mechanism which becomes inappropriate. And the reason for this is that the brain actually thinks that it continually needs to protect this area because it's actually receiving inappropriate or it's receiving danger signals suggesting that that area is still in danger. And what I see a lot in my practice is it could be that the athlete may be ignoring the healing time, so they keep playing even though the healing process hasn't actually fully resolved itself, and therefore they keep sensitizing these nerves, so these nerves keep sending the danger signals up to the brain. I think we probably see this a lot in athletes, and like Abby's saying, definitely in dancers, where it's mind over matter and the show must go on. Or the flip side of the coin is where some people become very protective over an area that's damaged or has been injured, and therefore they don't move it at all. So you start getting restriction, you start getting scar tissue laying down, and then when you do start moving it, that creates pain. If you feel pain, you stop moving it again. So basically what happens is the threshold of these danger receptors lowers. So it means small movements, light touch, things that shouldn't normally give you pain starts giving you pain. And this is, this I see a lot. You get the extremes, and that's normally why you end up having this prolonged almost danger signals going up to the brain despite the injury healing. Also, some athletes may have certain views about injury and experiencing pain, which sets off thought processes and behaviors which really sensitize their central nervous system. Central nervous system basically means the spinal cord and the brain, and they catastrophize the outcome. So they become so worried about their future that they don't want to move the joint because they're worried about the outcome too much. So I think this is, again, a very, very important point. Even the thought about not competing, or or even thinking about what may happen, can actually create pain. So our thoughts can actually create pain. And I think in Lorimer Mosley's clip, there's quite a few examples there of people experiencing pain and seeing other people in pain or seeing painful events unfold. And this is a very important part if we work with people in chronic pain. It's really controlling those thought processes, as those thought processes actually creates more neural circuits in your brain that creates even more pain.
It's an interesting one.
Something...
Sorry to interrupt you. May I just interrupt you at this point? It's just because, in hearing you talk about this, it's absolutely fascinating. And there's a number of things here. One, in last week's webinar with Leon, we were talking about the psychology of the injured athlete. And, some of what you're saying here, there's a relationship to athletes going back into training very quickly, post-injury. But also from the other thing I find very interesting as well is from an affirmation perspective, from a yogic perspective, as yoga practitioners, and understanding about the use of positive affirmation, a place for that within working with an injured athlete, obviously using different terminologies as yoga sports coaches. We honour Sanskrit, but we stay away from it. We understand it in terms of delivering it to the landscape, the language of the athlete. But there are lots of things that in understanding the profile of the individual, you can understand something of their relationship to pain, and then perhaps through the use of affirmation, and perhaps you were going to come to this anyway, Annelize, but I thought I'd just bring that up in case others in the session would like to, add anything at this point. So please do. Thank you.
Yeah, so just to confirm that, our thought and we will do a little practical in a little short while.
Yeah.
Well, our thought processes can set off a pain response. So remember, pain is the experience of our brains. Our thought processes are developed in our brain. So there is a very, very strong relationship, and we've all experienced when you stress, your shoulders get very sore, or that impingement in your shoulder, that tendon problem gets a bit worse when you're under a load of stress at work, or when your boss is on your case. We've all experienced emotional pain related to physical tension. So it's not just that the thought process creates pain, it's sometimes the thought process creates stress, that creates motor patterning issues, that then increases stress and reduce that threshold for our danger sensors. So that's something important to know. So just to show you, to really show you what happens in our brain when we experience pain. So Hayley, if you can move to the next slide.
Sure.
And this is quite interesting, and this really brings the point home. So this is an MRI scan of our brain, and this basically shows what happens at the moment, at the injury moment. So it just shows you, and this is just a few almost like slices through the brain, and all these red bits are the areas that lights up when we experience acute pain. And interestingly enough, if you look at the last, not this slide with the brain side on, so the middle image on the last line, that area there is actually our frontal lobe or frontal cortex, and this area of the brain is implicated in planning very complex cognitive behavior, personality, expression, decision making, moderating our social behavior. So it just shows you the brain calls on that area that really presents you as a person. So your whole life, future, past is pretty much stored in that area. So pain can really affect the person, the being. And just consider the impact that acute and ongoing pain experiences can have on our personalities and our behaviors, and how this can then mute or motivate our performance. And we all know that performance is all about the mental state. You can be as fit as you like. If on the day there's a slight doubt in your mind, or there's a slight niggle, or you have a slight negative behavior, it can really mute your performance. So really understanding and rehabbing pain behaviors are absolutely crucial for performance. So I hope this demonstrates that pain is truly an outcome, an output from the brain. So basically, just to confirm this point by Moseley in 2007, neuroscientists believe that pain is is 100% a construct of the brain and not from the tissue itself. If that's the only thing you take away from tonight's webinar, I will be delighted.
Yes.
And it's something that, that we as yoga sports coaches really can help us, like Hayley said, positive affirmations, visualizations, recovery, allowing that brain clamp just to release.
I think it's interesting.
Flooding in with positive input.
Yeah, and it's also like, as yoga sports coaches, being able to provide strategies, strategies for pain management. And, this is, as Annelize said, it's a huge area. And the level of expertise as a yoga sports coach, you absolutely understand what your role is. If you don't make it up. If you don't know, you refer to a specialist. Exactly. But certainly within your training and developing an understanding of yogic strategies. They're applied functional strategies through the use of the yoga sports science techniques that we've been working with over the years that can really help an individual feel as though they've got another tool in their toolkit other than the kind of physical biomechanical side, but also from performance related and also post injury and just general preparation and adaptation.
So, the statement, pain is in your brain, it is truly in your brain. So I think a lot of time people get poo-pooed almost and say, oh, it's all in their head. That's actually a very
because
true,
it is.
It is true. And it's not a joke, because the brain has got to decide on the best decision at that time. And if you're not in a good place, or if your previous experiences has not been good, your future may be may actually be massively affected by this. So this is truly not an area that should be taken lightly. And like Hayley said, if you feel you're not equipped or if you truly see somebody that's showing pain behavior, and we'll come to that, it's definitely worth referring these clients, or at least making making maybe the client aware of that and referring a patient or an athlete onto a healthcare professional that can deal with these scenarios in a professional way. Right. So, Hayley, if you move on to
yes, of course. I'm aware of the time, and there's so much that we can cover. So we're just we're going to keep going. Okay.
So so next slide. So this is going to be interesting, and this is and I'm sure there may be people that wants to share some of their stories about pain. If we think about the statement that the amount of tissue damage is not directly related to the amount of pain that we feel, and pain is not always a given at the time of tissue damage, then we need to really consider the following scenario. So basically what I'm saying there is tissue damage does not relate to the amount of pain that you feel. So I think the most simplest of and I think most of us has felt this, is the good old paper cut.
Yes.
What is it about the paper cut? It's not deep, it's not life-threatening, but it really, really hurts.
And it's really inconvenient, actually, as
exactly, because then you can't type, you can't use your pen, and that's what we do. We sit in offices, we write, we type, and especially now with iPhones and all this, technology, we need our fingers. So if you have a paper cut, it becomes this almost massive, painful event. But actually, if you think about the amount of tissue damage, there's almost nothing there. So I think the paper cut really demonstrates that tissue damage, the amount of tissue damage, doesn't always relate to the intensity of pain, because the mere old little paper cut gives you the experience of quite a lot of discomfort. And I think really, coming to the next slide, Hayley, if you move on, phantom limb pain is probably one of the most fascinating conditions that neuroscientists really use to describe pain, and really try and describe this point about tissue damage not relating to the intensity of pain. So phantom limb pain is a situation or scenario where pain is felt in a limb that doesn't actually exist. So maybe in an amputee, it's either lost arm or leg. And the fascinating thing is that 70% of people who's lost a limb still experience pain in that phantom limb. Some people say it itches, it tingles, it hurts. And interestingly enough, symptoms are worse when that person is stressed. Symptoms get worse when somebody comes close to where that body part was. Some people report they still feel a ring on their phantom finger, or that their hands are still clenched on the motorbike handlebar. Some people even still feel that phantom limb walking. They can't stop that limb walking or that arm moving. And pain after amputation is usually more severe if there was pain before the amputation. So it basically means there's a memory for pain. So the brain remembers. And the reason for this, and this is scientists has done loads of research on this, the reason for this is that there's actually our body has got a virtual representation in our brain. And this image here that you see, now I had to really practice pronouncing this word. This is called the homunculus, and it basically means little man. So this is the representation of the little man. So that's you in your brain. And the reason why it's a little man is just because it looks like a little man, but it's a very odd looking little man. and this area is just above the ear. So if you put your hand right on the crown of your head and you move down to your ear, that's the motor cortex and the somatosensory cortex, and that's where this virtual representation sits in your brain. So the scientists has actually studied this through a lot of MRI scans, and our virtual body let us know where our actual body is in space, and there's a word for that in YSS terms, and that's called proprioception. So it means your brain knows where your hand and your elbow and your shoulder is in your brain. You don't have to look at your hand and your elbow and your shoulder to know where it is. So that is represented in your brain. So if you close your eyes and you reach for a cup, you know how to do that, because that movement and that body part is already imprinted in your brain. And in phantoms, or people with amputated limbs, although the limb is missing, the virtual leg and the relationship of that leg is still represented in their brain. So that's why people feel the arm or the leg that's missing. So another very interesting point, somebody with no leg or no arm and no tissue damage is still experiencing pain. So again, this shows that tissue damage does not relate to pain or the intensity of pain. So there's a memory in your brain for pain. So if you're constantly in pain, that pain memory is going to be sensitized. So this really shows that pain is a perception or an output by the brain, and that you can feel pain without having actual tissue damage. So basically what we're trying to say is, if you have a brain, you are going to be feeling pain, and that's normal. But that explains to us why certain people or certain athletes goes into a pain cycle. So I hope you found that interesting, and this absolutely fascinates me. And we can really use this to smudge pain or to improve movement in certain areas by activating this virtual brain in our head. So Hayley, if we move on to the next slide, please.
Yeah, sure. I was just going to make a point there, Annelize, about the virtual body. I know in the past when I've worked with Paralympic athletes, so they've had, one athlete in particular, no feeling below the sternum, but the actual use of sport-specific yoga techniques to that athlete enabled the athlete to experience a whole body feeling. And I'm wondering whether that's because of the homunculus.
Yes.
Would that have an effect?
Yeah, and visualizing that movement actually activates that area in the brain.
Right, interesting.
So
it
by
stimulates.
Visualizing, it stimulates that area in the brain. So if there is pain in a certain body part, we can actually start smudging that area possibly by visualizations, by breathing techniques, by recovery techniques. So by thinking positive thoughts and thinking or almost thinking the pain and on releasing the pain out of certain areas, we can actually improve that representation of the healthy limb in your virtual brain.
Yes.
So this is a very, very powerful area that we can tap into as yoga sports coaches, not just for injured athletes, but also for any athlete with some of a movement issue or a motor patterning issue. Just visualizing you doing a movement pain-free with fantastic sufficiency, not even so, just in the recovery position, can actually improve that virtual representation. So when you then come and actually do the movement, you may actually find that you have improved motor output. Yeah. Because then the brain is going to give you better output.
Absolutely. And again, I think that makes a fantastic case for the benefits of an athlete, on the mat, in terms of what they're able to experience on the mat. That kind of, reprogramming the neural pathways on the mat and then taking it into the sport. So you're actually helping, that repatterning. I'm getting lots of vibes here from people. It's like they want webinars on this stuff. Can we have more? Give us the webinar on the homunculus. Come on.
Yes. Okay. Even though I can't pronounce it, we can do it.
Okay, listen. Because of time, Annelize, we're going to have to crack on if that's okay.
Okay, let's crack on.
Do you want to go to the slide? Do you want to go to the lemons?
Yes, so actually on this point, seeing as we've touched on how visualization can actually improve or even smudge painful areas in certain parts, I think let's just to wake everybody up.
Okay.
If they're not awake.
No, they're all raring and the hands are going in the session. I can see people are jumping up and down all over the world.
So just to quick, so if you just move to slide 9 for me, please.
Yeah. Sure. So we're going to just bypass the context of pain.
We're going to bypass this. I think we've touched on that.
Yeah.
So I just want to quickly show you, and then we'll come to our visualization, and then we'll probably finish off.
Okay.
So just to show you what happens when the alarm bells or these danger signals comes up the spinal cord, and now your brain is giving you pain because it's trying to protect this area, and rightly so. That's why we have brains, or a brain, because it needs to protect when there is danger. So for instance, use that basketball player. So that ball's just landed on his finger, hyperextension. That sensory input, possibly of inflammatory chemical sensitizing that area, goes up the spinal cord, goes to the middle of the brain. The brain is asking, has this happened before? What's happening? What stage of the game is this? Are they losing? Are they winning? Has it happened before? And it goes, no, all's fine. I'm going to just give him pain because this is quite a bad injury. So that athlete possibly immediately grabs the hand, keep the arm close to the body. So there's a guarding, there's a protective muscle spasm that possibly goes right up the arm into the upper traps, points the arm up, elevates the shoulder blade. So all these fast twitch global muscles go into immediate protection, because it needs to protect that finger so it can heal, so no further bleeding occurs. So we always, as physios, we always try and reduce that bleeding stage, because the more bleeding you get, the more scar tissue potentially can form.
Right.
So like I said, almost immediately, so we started on guarding and pressure, almost immediately you start getting, literally, and I see this every day, within a couple of seconds of that injury happening, our altered motor patterning starts creeping in. So that athlete keeps the elbow flexed, the shoulder is tucked in, the upper trap starts activating, and there's reduced range of movement almost straight away. You're not going to want to move the wrist maybe, so after a few minutes you start relaxing the shoulder, maybe start moving the elbow because you realize that's not where the pain is, but you possibly don't want to move the wrist, you possibly don't want to move any of the other fingers, so you almost immediately get this altered motor patterning, reduced range of movement, and almost immediately, because pain is such a powerful thing, it starts switching off things to preserve energy. So over a period of time, if this carries on for days, very quickly you start reducing the range of movement, maybe even in the wrist, reduce strength, can't pick things up, and I would hope within these first 4 phases, most physio or most people will hopefully not even go any further, because these injuries will just heal and there will just be a normal healing process. The patient will do their price, so rest, ice, elevation, compression, gentle mobilization, and they'll just slowly over a period of time get back into the sport. But in certain athletes, they go into that possibly for specific reasons, past injuries, where they are in the game, whether they're possibly up to sit or to not be picked for the next game, maybe their relationship with their coach, they stop moving, they start catastrophizing, and therefore their sensory threshold starts reducing. So it means activities that normally shouldn't be painful becomes painful. The brain starts catastrophizing, so there's some central sensitization going on. More pain because there's no movement possibly, or they're moving it too much, or they're stressed about it, or catastrophizing. More pain gets fed to that person, and then because they're constantly feeling pain, there's constantly danger signals, the thought viruses starts creeping in. So the thought viruses, basically,
that's a very interesting description. A thought virus. Very interesting.
Thought viruses starts creeping in.
Very interesting.
So some thoughts activate these alarm signals. So it's that whether it's their place in the team, whether it's they're thinking, oh my goodness, I've got a very important game in 6 weeks. I'm not going to be ready. This is really bad. I'm really negative. There's pressure maybe from the coach. And then the brain starts realizing that there's some there's some danger. So the brain starts protecting more, giving more pain. And then these thought processes, these negative thought processes leads to what we call pain behavior, fear avoidance, not wanting to move, catastrophizing, becoming hypersensitive to any form of movement, even movement that shouldn't, even light touch sometimes becomes an issue. So this is worst case scenario. And I hope, you know, if people get the right type of treatment and management in the first few phases, hopefully they'll never go into the rest of this cycle. Sure. And what happens?
Sorry.
Yeah.
Well, I was just going to say something. I mean, I know we're coming to the end of the session now, and you're going to move on to something as a practical visualization to give people to start using with their clients or athletes. But I was interested to kind of bring in at this point from another strategic perspective with yoga sports science, is that actually what happens, and certainly from the experience I've had with athletes, and also from myself as well, being in pain, is that the first thing that goes is the breath.
Yes.
The first thing, if you're feeling any discomfort or any pain, it's like you just stop breathing.
And what happens then? You start using your upper traps.
Yes.
You start using your secondary respiratory muscles that then increases the tone.
Yeah.
Really stiffens your neck.
Yeah, so it compounds to
really
the whole issue.
Locks you in. So it just actually makes the whole, so if we're in pain, there's anxiety, ongoing pain increases stress levels, coping strategies.
Yeah.
So I want to prove this point to you now.
Okay.
by doing a lovely final activity with you. And
Great.
This is something that you guys can actually put in practice tomorrow, if you like, with any client who you feel may be suffering maybe with this altered alarm system in the brain. So the alarm system has gone a bit haywire. It goes off without any intruders coming in. So let's move to slide 3, and we're going to just do a little visualization.
Slide 3.
Oh, sorry, slide
go to the lemons.
13.
We're going to the lemons. It sounds like we're going to the wall.
To all be lemons now.
Okay. Here we are. We're with the lemons.
Right.
Can you see the lemons?
Yes.
Yeah, great.
I can see the lemons.
Perfect.
Right. So I want you all to sit back, relax now. We're going to do a lovely visualization just to finish off. And I want you to really zone into, just zoom into this image for me, seeing this lovely yellow, bright 3 lemons. So just take a couple of seconds just to really take that in for me.
And breathe as well.
Then I want you
breathe.
to, just take a nice deep breath in after all of this. I need to breathe as well now.
Yeah, just take a nice deep breath.
And then once you feel you've got that visual, I want you just to close your eyes. And I want you just to bring that image strongly into your vision now while your eyes are closed. And I want you to imagine these bright, lovely yellow, 3 yellow lemons on a plate. And I want you to just imagine you taking a very sharp knife and you slicing these lemons into 2 halves. See how the lemon segments fall apart as a small cloud of zest bursts from the fruit, filling the air with a lovely citrus aroma. Then imagine slicing each of the half segments. Again, noting the lemon falling to the side, letting off a fine cloud of fresh juice with a lovely aroma. Now, imagine taking one piece and gently placing it on your lips and tongue, noticing the flavor, the texture, and how your body responds to that. And you can, when you're ready, you can slowly open your eyes. And I don't know about you, but I'm salivating.
Well, yes, I think it's
can
wonderful.
Actually feel the sides of my tongue.
Yeah.
It almost feels like it's contracting slightly.
Yes.
Whether that's just nerves, I don't know. So, as you probably noticed, the body responds to this visualization, and you salivate as if the lemon is truly there on your palate. Exactly the same happens when we play out scenarios in our head that are negative. In pain, we often err towards negative thinking about what the pain means, and this is true for most athletes, and what will happen, what does the future hold? Can I do my weekend activities? Can I do my game in 2 weeks' time? What's going to happen? What's going to be the consequences? Is it going to impact on my career? Sorry. So the power of this thinking is immense, and it has very real psychological effects like you've just experienced, including the increasing development of powerful neural circuits in the brain. So these thought patterns, they're real. They make real neural circuits. And Richmond Stace, again, I'm gonna take his phrase, and I just think this is wonderful. He says, nerves that fire together, wire together. So the more you think negative thoughts, the more these pathways wire together, and they become real, and they don't go away until you address them. This means that we tend towards, in this painful scenarios, that we tend to become hypersensitive to any sort of sensation in our body, and to our own thinking that can be catastrophic. And these thought patterns reignite these neural pathways and keep triggering protective responses, and that makes us feel even more anxious. That creates more stress, more tension maybe in those upper traps. We breathe less, and again it just sets off that pain cycle. So I hope that from this you can actually see this is one of our most powerful tools, visualization, to really try and help improve and rehabilitate painful and these thought viruses that becomes a very, very, very real situation for people, especially in chronic pain. So chronic pain means the injury has actually, the damaged tissue is actually healed, but that pain pathway has reignited, and that potentially, like we saw in that cycle, can really influence motor patterning, and essentially performance. So I hope from this webinar tonight you understand a little bit more about how pain is produced, that the brain is the thing that analyzes the input that comes from potentially damaged tissue, but also from our thoughts, our behaviors, and that these things influence each other. And as yoga sports coaches, we have certain tools that we can use to really tap into the central nervous system and actually desensitize and help people to improve their performance and their quality of life. Not just your athletes, maybe even your normal clients in your yoga class. So I hope you've enjoyed tonight.
Annelize,
if there's any questions,
yes, absolutely. Please.
I know it probably feels quite overwhelming, all of this, and we will do a part 2 to this where we'll give you more practical tools to use and show you exactly what we as yoga sports coaches can specifically do to improve people or your athlete who experiences pain.
Fantastic, Annelize, really outstanding. And I said, sort of earlier on, and talking to different people about your session you were going to be doing, the first in this series was certainly going to be thought-provoking and insightful, and you have definitely done that. I know I have a different understanding of pain and the neurological responses now, and I think also it'd be interesting to hear your thoughts, all of you, in the session when you get on the mat, when you get on the mat tomorrow, and perhaps working gently into a pose that eludes you, and just having a different awareness to what Annelize has said, and perhaps also tracing back your own story, your own kind of pain story. And if you haven't yet watched the supporting videos to this webinar, please do, because I think that will really help to sort of bring everything into context. Annelize, thank you so much. We're looking forward already, getting questions coming in already from everyone. When is she doing another one? When can we get more?
Please feel free to email me if there's anything tonight that you want more clarification on, or any resources. I'm more than happy to put that out in our community community forum as well.
Thank you.
So that you can do some further reading.
And I know that some of you in tonight's session have joined us through our Facebook community. If you'd like to come into the yoga sports coaching community, where you can have a free membership and actually find out more about the course, Yoga Sports Coach course, you can certainly join us, log on straight away, and you'll be linked into our forums. You can also contact us as tutors and also be a part of the wider Yoga Sports Science global community, which is, helping to pioneer these changes to help athletes find these strategies, and not just athletes but also dancers. So thank you to Abby to come into the session. Annelize, thank you once again, and please stay posted, all of you, to find out when the next one is going to be. It will be in the new year. So take care, all of you. If we don't get a chance to hook up again before Christmas, wish you all a wonderful Christmas and a very happy, healthy, prosperous new year. Take care, all of you. Thank you. Good night.